On the day of your admission, you will come directly to the bone marrow transplant unit on the 4th floor of the North Carolina Cancer Hospital. Your nurse coordinator will have given you instructions about how to prepare your belongings.
Hi, how are you?
Fine, how are you?
Doing well. Welcome to the bone marrow transplant.
Hi, I'm Kendall Johnson. I'm here for the
Upon your arrival to the unit, you will be greeted by your nurse. You will get to know many of the BMT nurses well during your inpatient stay with us.
Take you back to your room, okay? If you'll follow me, all right?
Your nurse will show you how to clean your belongings and will show you to your room. He or she will review with you the daily routine of the unit. Your nurse will spend time making sure that you're comfortable in your room. You'll be shown how to use the call bell and how to use the bed features. Your nurse will remind you and your caregiver about the importance of good hand washing for everyone entering the bone marrow transplant unit.
Really gotta work it around, get your finger.
You are encouraged to ask everyone coming into your room if they have washed their hands. And if they did not, please ask them to do so immediately. Your nurse will explain how we use the calendar to keep you up to date on your labs and your count recovery.
Hemoglobin, your white blood cells, and your
Each room has a television, a DVD player, and a Wii game system. You'll be shown how to operate each of these. Each room has a refrigerator, a daybed, and of course a private bathroom, which is for patient use only. There is also a separate family and visitor lounge with bathrooms, computers, and a television for family use. Our unit also has a washer and dryer available for your convenience. There is also internet access in each room for patients who would like to bring their own personal computer. Your nurse will take your vital signs and obtain an accurate height and weight. Daily weights will be an important part of your care during your admission. An admission assessment will be completed. There will be lots of questions, some of which you may have answered previously. It's very important to us that we have the most up-to-date information so that we may provide you with the best care possible. Once you are settled into your room, your nurse will draw blood so we will have your most recent lab values. During your first few days on the unit, you'll meet the nurse manager. The nurse manager is available to talk with you throughout your stay, so be sure to let him or her know if you have any questions about the day-to-day operations of the unit.
Has everything gone well so far?
Yes, very well.
While you're on the unit, the team will make daily rounds. They will spend time discussing your care and answering any questions that you may have. You'll be provided a pen and a pad of paper so that you can jot down questions as you think of them. That way, you won't forget to ask your questions when the team is there.
Oh, that's wonderful.
Before your actual transplant day, you will receive your preparatory regimen. Your doctor will have talked with you prior to admission about the chemotherapy medicines that you'll be getting. Some patients may also get radiation as part of their preparatory regimen, but the treatment you'll receive will be discussed with you ahead of time. When your preparatory regimen is complete, you'll be ready for your transplant. The day of your transplant is an exciting time. Remember, receiving a transplant is not a surgical procedure, but is very similar to receiving a blood transfusion. You will be closely monitored during the process. This is the day you've been working toward. Congratulations!
So, as we get started, you may notice a warm flushing sensation. You may notice a tickle in your throat. You may taste something like tomato juice. You also may feel...
Now the waiting begins. Once you've received your transplant, it may take several weeks for your new cells to start to grow. Each day, your nurse will update your calendar so that you will be able to keep track of your white blood cells and watch them rise. While you're in your room, it's very important that you get adequate exercise to maintain your strength. Your recreational therapist will meet with you regularly and help you to find an exercise plan that works for you. Because our bone marrow transplant unit is specially filtered, you are allowed to get out of your room and walk in the hallway. However, you will have to wear a light surgical mask when you're outside of your room. During your stay, you are also allowed to have visitors. One visitor is allowed to spend each night with you.
How you doing?
Good, how are you?
Good to see you.
Good to see you.
You may also receive a visit from pastoral care, the social worker, or other members of the team.
And you'll have at least a comfortable time here. And
Once your blood counts have recovered, your nurses will begin to prepare you for discharge. You will know when your discharge will happen several days prior to actually leaving the hospital. Discharge from the bone marrow unit will occur when your absolute neutrophil count, or ANC, has recovered for 3 days in a row and has not decreased. You do not have a fever, you're drinking fluids, and you are able to take your medicines by mouth. Your nurse will review with you and your caregiver the steps necessary to protect yourself from infection. You will be advised to take your temperature daily. You will be encouraged to wash your hands often. And you will be given several masks to take home with you, so you always have one available to wear when out in public.
I will actually give you more than one.
It will be important to continue to drink up to 2 liters of fluid each day to stay hydrated. For many patients, eating can be more of a challenge. Once you're discharged, the outpatient BMT clinic will help if you have problems with nausea or other stomach upsets. The clinic will review diet choices with you, although you will be advised to avoid eating the food in cafeterias or buffet restaurants. Because of the chemotherapy you received, some foods may taste different after you've had a transplant. Good mouth care may help with taste changes you may have during your recovery. Directions regarding how to change your central line dressing will also be reviewed with you and your caregiver. Your dressing may need to be changed after you leave the unit. Safety precautions with line care will also be reviewed. Supplies will be given to you to help protect your central line and change your dressing if necessary. By the time you are discharged, you and your caregiver will feel comfortable caring for your central line. Before you are discharged, the pharmacist will sit with you and review all of your discharge medications with you and your caregiver. You will know the time to take your medications, why you are taking them, and their importance in helping you to recover. Copies of all of your prescriptions will be given to you at discharge. After you are discharged, you'll be returning to the outpatient bone marrow transplant clinic within the next several days. Usually, an appointment will have already been made for you, so you know exactly the day and time to return. Please remember to bring all of your medications with you to your clinic visits for the staff to review. Discharge is an exciting time. It's what you've been waiting for since the moment you entered the hospital, but feeling nervous or scared are perfectly normal feelings too. Before you leave, you and your caregiver will be given the knowledge and tools necessary to make sure you can successfully manage outside of the hospital setting. After discharge, you and your caregiver will be expected to stay within a short distance from the hospital. Your caregiver will be able to run errands such as grocery shopping or going to the drugstore. However, your caregiver should plan on spending most of their time with you. If more than one caregiver will be sharing this role, it's important to ask them to be present as well when your nurse is reviewing discharge teaching. This is a time for recovery. Many patients have feelings of weakness and fatigue after their transplant. It often takes several weeks to months to recover your strength and the ability to complete all of your daily activities without needing to rest. How long it takes for you to feel yourself again is very individual, and many times it is dependent upon the type of transplant you received. Recovery usually takes longer in those patients who have received an allogeneic transplant. It will be important for you and your caregiver to plan both rest and activity into your day. Be sure to wear your mask whenever you're around freshly mowed grass or gardens, areas of construction, or crowds. When you leave the bone marrow transplant unit, you will have phone numbers that you can call if you have questions or do not feel well once you are discharged. Usually, you will call the BMT outpatient clinic during its open hours and the BMTU after hours. No matter what time of day, though, someone is always available to take your call. Remember, you are the key that is necessary to making your transplant a success. We are here for you at any time, so you're never alone. If you have a question, just call.